Hey now, I'm Jack Cush, Executive Editor of RoomNow.com, and this is the Week in Review as of today, the 4th of March 2016. I'll review for you a number of the items that were covered by RoomNow in the last week or so. I'll start off with some of the short form instruction delivered in social media. Number one, I thought what was interesting, and that was a report about urinary biomarkers that actually was presented at the ACR meeting and recently published, and showed that you can actually use some of the proteins found in the urine to correlate with disease activity in RA. This includes soluble CD14, gelsolin, oral mucosoid 1 and 2, and these actually perform quite well as biomarkers, and this form of assessment may be part of our future. Interesting to watch for this. A report from the GI world, and you can get these citations on the social feed on the website, showed that a cohort of IBD patients, those with Crohn's disease mostly, and some ulcerative colitis, who had a prior history of cancer, who then went on to receive a TNF inhibitor, did not have a higher risk of cancer, suggesting thus that if you have a prior history of cancer, that does not preclude the use of a TNF inhibitor. This, of course, is one of the new guidelines that appears in the ACR publication from September on RA treatment guidelines, that it is safe, especially with solid tumors, to give people a TNF inhibitor. You should treat them as you normally would. A reminder that something we should all know is that poor sleep often shows up in our clinics with a number of non-articular manifestations, including fatigue, poor memory, widespread or magnified pain, recurrent severe headaches, numbness, and dysesthesias. There's a report from the temporal arteritis world, giant cell arteritis, actually, in a review of 228 patients who had temporal artery biopsy. The factors that were most predictive of the ultimate diagnosis of GCA was headache, high ESR, jaw claudication, and thrombocytosis. Not surprising, but nonetheless confirms our classic thinking. There was a report about interesting neurologic findings in lupus, posterior reversible encephalopathy, what's called PRESS. It is a rare manifestation of lupus, maybe about 1% of patients, and uncommon amongst all the CNS manifestations, but nonetheless it is increased in patients, especially those who have hypertension, renal insufficiency, high disease activity, and lymphopenia. Strangely enough, hyperlipidemia was also a risk factor, and that's not explained. A limited experience with Actemra has shown that Actemra has been used safely in 61 pregnancies with a large number of live births, 18% spontaneous abortions, about what you might expect from the normal rate of those events, and no events of congenital malformation. There were 5 patients who delivered low birth weight individuals. A nice report on the review of brucellosis, especially monarticular brucellosis. Lenny Calabrese retweeted this and said, you know, one joint always gets tapped, and it's for this reason. The association with monarticular brucellosis often affects a few select joints. When it's the SI joint, it happens in the young. When it affects the shoulder, it happens in the elderly. Knee, ankle, and wrist monarticular brucellosis is quite benign. However, SI, hip, shoulder usually has more severe, more recalcitrant, and refractory disease. I wrote a blog that appeared on the website called Biological Negativism. It's about the negative narrator in our patients' heads and why they won't make the decisions they need to make to take medicines and do the right thing. It might be worth reviewing if you have these discussions with your patients. The CDC has reported that the flu vaccine that's currently out is actually quite effective, has been shown to protect against influenza in 59% of the cases that have been given, and that the flu is still currently active, and that maybe another month of giving the flu vaccine makes sense. The CDC has also reported on the update on the Zika virus and its associations, of course, with pregnancy. There's a new recent report that we wrote about as a feature article showing that the Zika virus in a cohort of patients from French Polynesia was associated with the onset of Guillain-Barré syndrome. So up until now, Zika virus was like dengue and chikungunya virus with acute illness and polyarthralgia fever, etc., but was particularly a risky infection in women because it's been associated with birth defects and microencephalopathy, etc. But now this association in adults with Guillain-Barré syndrome makes you wonder whether there's more to this than just an acute self-limiting viral illness. There is, as you know, an announcement that Pfizer has soon to release Xeljanz as a once-a-day formulation. It will be 11 milligrams once a day. It has the same indications, same safety concerns, and can be substituted for the 5 milligram BID dose. That will become available on March 14th. There is a Canadian study from 2 different provinces in Canada that actually showed, actually wider than that, studying 56,000 RA patients. They had 37 TBs and 211 non-tuberculous mycobacterial infections, what we used to call atypical mycobacterium. Recognize that NTM is actually more common than TB. The risk of these infections was seen not surprisingly with TNF, but also with other drugs, including Arava, prednisone, cytoxan, azathioprine, cyclosporin, and mycophenolate. And for those of you who are interested in biosimilars, you can look at the February 22 tweet on this, which gives you a nice link for a CME course on biosimilars, which can help update you on where you should be. A report that was in today's literature, which comes from the AAOS, the orthopedic meeting, which is, I guess, in play. 2 different abstracts showing that injections prior to hip replacement is associated with a higher rate of infections. 2 different studies showing that injections within 3 months, or another study within 6 months, of joint replacement surgery in the hip or knee was associated with a substantial increase in perioperative infectious risk. Hence, we should avoid that, have conversations and good communication with the orthopedist. There's an interesting report out of Taiwan that looked at a large cohort of individuals from their database that have a history of chronic hepatitis B, yet they received chronic methotrexate. And in that cohort, they did not note a higher rate of cirrhosis. I wouldn't necessarily advocate for this, but it is a little bit comforting that if that event happens, it's a relatively low frequency event, especially in RA. I doubt this would be the same if this was being studied in psoriasis and psoriatic arthritis, but more research is needed in this area. I did write a nice review, a drug safety review on heart failure and the use of TNF inhibitors. As you know, that's a relative contraindication or warning in the package label, but that data comes from cardiology patients and not from rheumatoid arthritis patients. TNF is very important in the pathogenesis and demise of those who have severe CHF. However, when this has been looked at in RA patients, there does not seem to be a signal there that is worrisome. Hence, there are guidelines out there that suggest you may want to use a TNF inhibitor in those who have well-compensated, well-controlled New York Heart Association Class 1 and 2 disease, but Class 3 and 4 disease is probably not a good idea. Early aggressive treatment with in the elderly with rheumatoid arthritis in 2 large Canadian cohorts has been shown to be associated with less future need for joint replacement surgery. Again, underscores the need for treat early, treat aggressively. And lastly, there was a nice review article at the beginning of the week wherein several leaders in the technophile, social media, electronic education of rheumatology world, people like Paul Sufka, Ronan Kavanaugh, Philip Gardner, and Suleiman Bana, I asked them to give me guidelines for, not guidelines, but their recommendations for applications that you can have on your phone that are useful in daily practice. They came away with an impressive list that you should look at if you've got an iPhone or an Android phone and use it for at least Hippocrates. There may be other things on there that could be helpful to you in your daily practice. That's it for this week. Tune into Room Now. Register at the site. You can receive a weekly review of what happened at Room Now by just registering and going to your account and choosing that you want a weekly report in addition to your daily digest. That's it. Talk to you soon.